Well, good afternoon and welcome back to our Department of Labor and Economic Opportunity webinar series focusing in on workplace mental health. As you all know, there's a Q&A box at the top of your screen and you can submit questions at any time throughout today's presentation. We'll try to get to as many as we can at the end. And if you haven't already, please make sure you sign up for emails on our michigan.gov/workplace mental health page. That site, you'll find our report, the Surgeon General's report, the recordings of all of the webinars that we've had, and other links and resources that we've made available falling under those three pillars we keep talking about, which are things that are happening in the workplace, things that are affecting the workplace, and then those individual behavioral health supports. We try to make sure we hit on all those pillars throughout the various content of our webinars, and today is crossing all three. And we're really excited about the discussion we're having today because we're going to explore, as you saw in the invite, the critical role of language access programs in improving mental health outcomes for diverse ethnic communities. And we know in all the work that we do, it's not very valuable if we don't make sure that everybody has access to it. And one of the key ways that we do that is making sure that we're translating documents, making presentations available in other languages, making sure we're using bilingual folks that can do direct outreach to different groups across the state of Michigan. We have two great experts to talk with us today about how impactful language access is, as well as how impactful it is when we're talking about mental health. And we have Guadalupe, who works with us in Leo, very excited about that. And she brings over a decade of extensive expertise and dedication to her role as our statewide language access coordinator. She oversees the development and implementation of language access plans across Michigan State departments, agencies, and bureaus. And you can see her work anytime you go to one of our web pages. So we appreciate her so much. And we also have Ashley Hanberry, who is a refugee mental health coordinator. She works with refugee services team to better understand the mental and behavioral health needs for refugees in Michigan and offer technical assistance and support to the Office of Global Michigan's refugee service providers. Ashley has over 10 years of experience as a licensed mental health professional. So I'll kick it over to you, Guadalupe, to get us started, and we'll look for those questions coming in.
Thank you so much, Sean, and good afternoon, everyone. Again, on behalf of the Office of Global Michigan, thank you, Sean, and your team for inviting Ashley and I for this month's webinar. Again, my name is Guadalupe Ayala, and I use she, her, ella pronouns. I am the statewide language access coordinator, as Sean mentioned, for the state of Michigan. And today I'm here so we can all explore a crucial topic of language access and the impact on mental health outcomes for ethnic communities. I will be discussing some of the key points, like really understanding what language access is and its importance, what it entails to plan for the provision of meaningful access, and again, we'll talk about the impact. So to get started, and before we really go into the topic, I wanted to give a little more of a plug for our office at the in the state of Michigan's Department of Labor and Economic Opportunity. Just so you get a glimpse of the work that we really do. And at the Office of Global Michigan, we really work to make Michigan welcoming and inclusive. And we take the lead in advancing equity and inclusion initiatives throughout the state while coordinating programs for the seamless integration of newcomers in our state. Our goal is really to strengthen the connections between communities by ensuring that our programs in the state and opportunities are accessible, inclusive, and positioned to have the best possible impact. Within the Office of Global Michigan, I am part of the Equity and Inclusion team. And within our unit, we oversee workforce development partnerships and also equitable access to services, specifically, which include language access. Our office and our unit are really committed to enhancing services and fostering engagement with Michigan's diverse and vibrant communities. So now we're going to dive a little bit into the topic. What exactly is language access that we are hearing about? So language access really refers to the ability of individuals to receive services and information in their preferred language. And really this involves ensuring culturally competent communication and providing translation and interpretation services. Interpretation is really the act of listening to a communication in one language, so the source language, and orally converting it to another language, the target language that the individual speaks, and all of this while retaining the same meaning. So that is interpretation. And when we talk about translation, it is the transcribing of documents from one language to another. And one of the things that we need to keep in mind when providing language access in all the forms of communication, we must use plain language. And this really is avoiding any jargon and using, everyday language just to make sure that your audience can understand you the first time that they read or hear something that you are communicating. This is really important because even when a person is translating a document that doesn't have plain language, things can be really misinterpreted or translated into what you're really trying to say in the other language. Overall, like language access is about breaking down barriers to allow individuals that speak a language other than English an opportunity to really participate in and enjoy the benefits of programs, activities, and services as English-speaking individuals do. So, going further in the importance of providing language access, we know that it ensures equity in service delivery, allowing everyone to access, for example, healthcare, education, social services, and any information that an entity is trying to convey. And additionally, many organizations are legally required to provide these services. There's federal law such as Title VI of the Civil Rights Act of 1964 and Executive Order 13166, which mandate language access for limited proficient individuals and making sure that there's equal access to public programs and services. Additionally, in our state, we have the state of Michigan, we have our own language access regulations that really reinforce the federal requirements. Our Governor Gretchen Whitmer, has proclaimed Michigan as a welcoming state. And as we know that newcomers from around the world have helped build the shared prosperity in our state. Clients communicate in their preferred language. It just fosters better understanding and trust. And my colleague Ashley will get into how crucial that is when we talk about mental health services. So what I recommend employers and organizations to do first is knowing the importance and knowing that after they know the importance of language access is to know who their workforce is or their communities, if they're looking at a language access plan that is outward facing, or get to know who their workforce is if they're looking to provide language access within their workforce. And this can be done by conducting a needs assessment. And a needs assessment is really a systematic process used to identify and address gaps in services, particularly in this case concerning language access for both either employees and or your clients. And for employers, conducting a needs assessment, it is very important as it helps your organization understand the specific language and cultural needs of their diverse workforce. And the information, the insight that you get from this is used to create tailored mental health resources that are accessible and relevant to your workforce. And this will help in ensuring that employees feel supported and that they can enhance engagement and retention. So when employees know that their unique needs are being recognized and addressed, they are more likely to stay with the organization. Lastly, conducting a needs assessment really promotes a positive work environment. It really fosters inclusivity and belonging by demonstrating that the organization values diversity. But most importantly, is committed to meeting the needs of all employees and this creates a healthier workplace culture for all. And then after, conducting a needs assessment, I would advise employers or organizations to create a language access plan. And a language access plan is a structured framework that outlines how an organization will provide language access services to ensure that all employees and our clients can really communicate effectively. It outlines processes such as who to contact, the policies that you have developed after, getting the insight from the needs assessment, how to communicate with your constituents, who should be trained within your office or your department. Most importantly, language access plans include a sustainable commitment, right? That's something that lives in your organization to ensure that equitable access for all clients and our employees are met. And a great resource available to all is lep.gov. This is a federal website that provides a lot of valuable information and resources and even data that will help in your planning of your own language access plan within your organization. Again, whether that is something that you're looking for your employees or for your clients. So now that I kind of laid the groundwork for understanding what language access is, I'd like to hand it off to my colleague, Ashley Hanberry, who is part of the Office of Global Michigan's Refugee Services Unit. And she will get into more of the how language access specifically improves mental health outcomes for our ethnic communities. Ashley.
Thank you, Guadalupe. As Guadalupe said, my name is Ashley Hanberry. I'm the Refugee Mental Health Coordinator for the state of Michigan. So my role is really working with our refugee and immigrant population, try to make sure that we have equal and equitable, inclusive mental health care for anyone who may need it. So I want to talk a little bit first about just kind of what language access and mental wellness look like for people across the state. And why language, when you're not preferring English for your therapy session, why that can be such a challenge and a barrier. So go ahead to the next slide. Thank you. So to take a minute to have you think about being in a position where you are like, hey, I think I might need some therapy. And that can often feel really overwhelming and very daunting. That requires saying, I'm struggling, I'm admitting that I'm struggling, and I need to find somebody to talk to about it. It's an incredibly vulnerable experience, and it can be just like really overwhelming to think through how to find the right person, how to make sure that you're going to feel connected, that you're going to be emotionally safe. And then on top of that, now let's throw a language barrier in place. The majority of the therapists, mental health care providers in Michigan are English speaking. We are thankfully growing a wonderful network of bilingual or multilingual therapists. But if you're looking online, if you're getting a referral, the chances are that your therapist that you're being referred to is English speaking is pretty high. And that can be incredibly uncomfortable to think through having to use interpretation to seek services. So think through how you might express in English a different concern or feeling you might have. There's a nuanced difference between maybe saying, I feel frustrated by this, or I'm irritated by this. And somebody who has grown up their whole life speaking English might be able to kind of suss out those differences. But when you're adding a layer of culture and various languages where words for those two different emotions might not be this directly interpretable from a person's preferred language to English, that can really impact the delivery of services. That can really impact the ability for that mental health provider to really understand, guide, and most effectively treat the mental health concerns that a person seeking services might have. So language is incredibly important. And it's a huge barrier across refugee services in the state that we are working really hard to try to overcome. In addition, there's a huge burden on providers in being willing to work with interpretation services. So let's take a standard Medicaid rate for an hour session. A mental health provider is going to receive around like $70 to $80 in a reimbursement for that session. At the moment, how the state is currently set up, the provider bears the burden of costs for interpretation. So immediately they're having to take $55-ish off of that $70 to $80 to cover the interpretation costs to even see that client, to provide them good, inclusive, equitable services. And then that gives them a really small chunk of money to pay themselves, their bills, all of the overhead that goes with providing therapy. So with that, there are not a ton of providers in Michigan that are able to sustain seeing people who would like interpretation or require interpretation for their therapy services. There's also a extra dynamic when you've got an interpreter involved in therapy. That can be kind of difficult, challenging, uncomfortable sometimes for clients to work through. You're not only having to share really important, confidential, delicate, sensitive information with a new person, your therapist, but now you've got a third person either in the room or on the phone that's hearing all of it and having to take the concepts and make sure that they're translating, interpreting those ideas, those feelings accurately between the two different languages. And so that adds extra vulnerability. And there's an additional worry for many clients that this person may go out and tell others in the same language speaking community about whatever was shared in therapy. It takes quite a while to make sure that that trust and rapport is built in order to have really like effective therapy sessions. So what is being done? It's a very big problem. Most people who are seeking services, who would like their therapy services or need their therapy services in a language other than English, kind of avoid it because there's a lot of barriers. But we are doing some exciting things in the state that I wanted to share with you. So in Kent County, Kent County is, I believe, the second highest resettlement county in Michigan. And there is a really exciting pilot program that's currently being run to see if we can increase the provider network for people who are seeking services other than English. So Bethany Christian Services is working with Priority Health to run an interpretation reimbursement pilot. So essentially the client is coming in seeking services, the provider is paying the upfront interpretation costs, and then they're able to receive an additional reimbursement rate with their insurance claim. And this pilot started in September of 2022. And so as of September of 2023. So it just wrapped up its first year, and it seems like it's going to be continuing on. So with a full year of data collection, the program that specifically has been running this interpretation pilot only sees refugee and immigrant clients. So there's a lot of interpretation. The vast majority of clients in this program are using interpretation in their sessions. And after a year of data collection, Bethany is able to report that over 85% of the clients that were seen had reported a reduction in their mental health symptoms, which is incredibly, that's very strong data. That's a very solid number. Really excited and encouraged to be able to have that to show and demonstrate the efficacy of having covered interpretation and the need, I think, for continued expansion of services in this area. And we're just kind of thinking overall too about what does improved mental wellness look like for others in our community. If we're thinking kind of globally, we're wanting to make sure this access is in place. It's increasing work attendance for people. They're not going to miss as much work. It's increased school attendance for youth, for parents being able to get their kids to school. We're decreasing the use of the emergency room for mental health issues. It's not uncommon for somebody to be experiencing a panic attack and maybe have to go to the emergency room because they just don't understand. They haven't had that psychoeducation to really know what it is and how to navigate from there. And then we're having all of that leading to increased satisfaction in life, bigger positive impacts. We're having some of those generational traumas that can kind of go from one to the other reduced. And overall, I think it's an incredibly important piece for our communities to have in place, that increased access. So I think the goal, just kind of going forward with that, is to hopefully be able to take this data and work with other insurance companies or perhaps MDHHS. That's kind of all behind the scenes in the works, but just kind of wanting to make everybody aware that this is a concern and issue. There's some work being done on it, and any points of advocacy you might have in your lives or in your work, please share that this is happening and there's good, exciting data about it. I have a couple extra recommendations, kind of some more tangible takeaways going forward and how you might be able to help or just kind of gain some awareness around this. So I think the first and kind of the standard throughout, but so vitally important is making sure that we're getting implicit bias trainings and some cultural competency trainings. I think until you're really being able to think through some of the assumptions that you might hold that you're not aware of, and some ideas, lack of awareness around these issues in general, it's really hard to make any progress forward without having that kind of foundational understanding. And when you're in the workplace, I think also being able to take those trainings and then just remember, you may have a coworker who is struggling. They've shared that they're struggling, but their ability to access mental health services for cultural language reasons, like they may have additional barriers in place where you may not have those barriers, and say you may have barriers that your other colleagues don't understand that you have. So I think just having more conversation and awareness around this can create a lot more compassion, understanding, and room to be able to work together to get a more healthy, well society. Really tangibly, most companies with health insurance plans and benefits have employee assistance programs with those 3 to 5 sessions that are covered, and then they kind of can go from there. But in my experience, and I'm hoping it exists already somewhere, but I have never seen an EAP PDF given to employees in a language other than English. So off the bat, for somebody receiving that, they're not potentially able to kind of read and understand the nuances of what this document is trying to explain their benefits are. So if you have staff and there's a majority of them or a good chunk of them are speaking Kinyarwanda or Rohingya, maybe think about seeing if we can get that form translated into a language that your staff might be able to access better, and then be able to take the steps from there to receive the care that they may need or want. I think that is it. So Sean, I will throw it back to you. Thank you all for your time.
Yeah, thank you so much for that information. I think we have a few great questions that we want to get to. And one of the things that just for awareness, can you can either of you kind of identify sort of what are some of the main language we should be thinking about? I know we don't want to leave any particular group behind, but I know that when we think about what we're doing for our regulatory documents, I mean, there's like a big 4, a big 5, or big 6. How many, if you know, like what should people be thinking about in that space?
Hey, Sean, you did cut off a little bit for me, but can you repeat your question again? I got the last portion of your question, but I want to make sure that I answer correctly.
Yeah, the actual question is, what are the main languages spoken by communities or our population that is served in Michigan? And I think I was just saying, obviously, we don't want to leave anybody out, but
Yes.
People are interested in that.
Yes, so a great resource for that in any state is the census. I know we can't rely entirely off of the census, but that's like a great starting point just to get a huge glimpse of who is reporting, because we know that the census sometimes it's even some very limited into like the languages that individuals can put in their answer. But right now, what like the data is showing for the state of Michigan is that we have our top 4 languages spoken by those who have identified themselves as being limited English proficient in the state of Michigan. It is for the languages of Spanish, Arabic, Bengali, and Chinese. So those are the top languages. And again, the way that we are focusing our efforts within the state is to recommend departments and agencies to look at those 4 languages. And when they're prioritizing their vital documents and getting them translated, to look at those languages. But then if their departments have local offices, then looking at their local data more of, by county, we know that in Kent County, we have a larger Spanish speaking population than as in Ingham County, where that still might be Spanish, but not as, huge as it is in Kent County. And same thing in, Oakland County, we have a huge population of Arabic speakers. So it's always really important, like when people are prioritizing, their efforts in translating documents, to really see where these documents are, who the audience is, and like the location, and that will drive kind of like, how to prioritize the language and the documents that are being translated.
Yeah, and I think Guadalupe, when you are translating documents, we want to be sure that people are like certified or something.
Yes, definitely. So it's always important that we use qualified interpreters and translators, making sure that we don't put that burden on family members or even staff, that may speak a language, but they may not know it fluently enough to make sure that, that the message that they're trying to convey, especially in situations that are very, very vital or confidential. As Ashley said, it's really important to understand that a lot of I can include myself, in this situation where I've had experience that I've been the one translating as a 9-year-old for my mom for her health visits, and it wasn't a pretty picture for me to remember all the time, because I was really put in the middle of making sure that, what my mom was trying to communicate, if she was in pain or not, or something that she didn't like, in the way that something was provided. I was at 9 years old, kind of put in the situation of making sure that whatever I was translated was accurate. So we see that a lot, with a lot of communities, that they feel, kids are really put in those places that they really should not. And it's always important just for, our communities to get the same level of information as any other English speaker. So that's why it's important to use qualified and like professional interpreters.
Yeah, and I think I appreciate that. I think we think often when we talk about language access, we're always thinking about just direct communication, right? And the documents themselves are just so critical as well, because for a couple of reasons, but like I know people that conversationally can speak Spanish, right? But if you handed them a document, not a clue, right? They can kind of handle some of the language pieces. Ashley, this one might fall in your court. Uh, it's I'm putting two questions together, so please bear with me, and hopefully you can figure it all out. But first is there a process for identifying language needs of individuals that are served? But to go along with that, if somebody's looking for access to service, are there professional translators available, and how would they be accessed? So you got, what I was thinking about is what you were talking about for people seeking therapy and maybe needing a translator. Like how do we as like lay people, like how do we even identify that somebody needs that other language, and then how do we connect to services? It feels like you would be fumbling around in the dark, frankly, is what it feels like if you're English as a second language, or maybe not English at all, trying to figure out how to navigate these systems.
Yeah, so a lot of our bigger healthcare systems have interpretation services that are kind of upfront offered. So think about how if you go to the emergency room, there's frequently by the intake phones, there's that document that has, if you need this language, that language, there's a language line that's attached. So if you don't know where to start, my usual recommendation is look for a long-term therapy practice in one of those bigger organizations, because they usually have those kinds of resources very handy and ready to go. There's also some, not like through the bigger organizations, but there are some practices, mental health practices around the state that are specifically trying to use more interpretation services. They have a grant or something like that, so they're able to kind of have those up front. You can also Google. So if you quickly look up, I need interpretation in Kent County, I need interpretation in Detroit, there are many companies that will have long lists of languages that are available frequently over the phone. So if you're seeking services and don't really quite know where to direct somebody, you don't know where to go yourself, a Google search can also help just kind of pull up, like, where can I find a quick phone interpreter to at least get through this initial session, and then go from there. Therapists also tend to be able to help facilitate finding interpretation as needed. We're trying to grow training in that across the state, but there's a good amount that kind of can figure that part out.
Cool. I would presume this would be Guadalupe, and we'll use this one to wrap it up. And a great segue, Ashley, you helped me out on training because clearly we have some state of Michigan employees participating today, because the question is, will employees and or state departments be trained on language access requirements implemented in the state of Michigan?
Yes, so we are actively creating trainings on, on the implementation of language access policies that language access coordinators are creating within their departments. So from the Office of Global Michigan, we are providing technical support and training that is like the foundational piece. More procedural training on how your department will implement their own plans will come from language access coordinators themselves. So it is very important, again, because it in the provision of language access, training the departments and training employees on how to provide language access, how to identify languages. All of those things don't really come naturally, and we're creating like a burden for employees if they don't know how to accurately, service their communities as well. So that is something that we are creating and that we have been implementing, and we have trained already our language access coordinators, and we're working to. We have also trained our mid-level managers, those that supervise frontline staff, just getting them like a foundational, kind of like knowledge of what language access is and the expectations, and more of the procedural work come later on from their coordinators.
Awesome. Thank you so much for that. And thank you both, Ashley and Guadalupe, for joining us today. I can't express enough how important I believe language access is, and the diversity of our country and certainly our state is what makes us powerful. And we have to make sure that we're providing access to everybody that's here, doing what we all do, trying to build a better life for themselves, their family, and their children. So using the tools that exist and making sure they have access to all of the tools across the state of Michigan, across providers, to make sure that they can use not only our services as a state of Michigan, but they can use services for mental health, for schools, for work, you name it, to be a stronger part of our community and more inclusive in our community. So thank you both so much for the work that you're doing. We think it's hugely important, and I'm really excited that there are tools developed, there are tools developing to make sure that all of the folks in Michigan can access all of the great things about Michigan. So thank you all so much for joining us today, and we'll see you soon.